I can't hear you. Where is gone?
Good evening, everyone. I am Dr. Vaishnavi, and it's my absolute pleasure to welcome you all to this very important and future focused discussion on reimagining oral healthcare, the future of dentistry, enterprise, and insurance. An initiative by Voice of Healthcare on the occasion of World Oral Health Day. As we look at the healthcare ecosystem today, oral health is undergoing a significant transformation. What was once largely confined to chair side procedures is now expanding into a technology driven, innovation led ecosystem powered by advancements in AI diagnostic, tele-dentistry, digital workflows, and emerging startup models. At the same time, this evolution brings us to a critical intersection where clinical excellence meets digital innovation, private enterprise, and the growing need for the financial risk protection. Despite being a fundamental component of overall health, oral health continues to face challenges around access, affordability, and integration into daily practice. And this is exactly where today's discussion becomes extremely relevant. The larger goal here is to reposition oral healthcare not just as a clinical discipline, but as a digitally enabled, investment ready, and insurance integrated healthcare vertical. We have with us today an esteemed panel of experts who bring together perspective from clinical excellence, public health, academia, and entrepreneurship, making this a truly well rounded and insightful discussion. So it's my absolute pleasure and privilege to introduce our distinguished panelist for today's session, Dr. Sandesh Mayekar, Indian Academy of Aesthetic Dentistry. Welcome to the session, sir.
Thank you very much.
Dr. Ritu Duggal, Chief Center of Dental Education and Research, AIIMS, and Professor and Head Orthodontic and Dentofacial Deformities. Welcome to the session, ma'am. Um, Dr. Vikrant Mohanty, Professor and Head Department of Public Health Dentistry, Maulana Azad Institute of Dental Sciences, and Vice President, Indian Association of Public Health Dentistry. Welcome to the session, Dr. Vikrant. Dr. Amit Agrawal, Professor and Head Oral and Maxillofacial Surgery, Seema Dental College and Hospital. Welcome to the session, Dr. Amit.
Thank you very much.
Dr. Laddu Singh Rajpurohit, Professor and Head Public Health Dentistry, Dr. D.Y. Patil College and Hospital. Welcome to the session, Dr. Purohit.
Thank you very much.
And Dr. Prachi Deval, Founder and CEO, Dent at the Rate Home. Welcome to the session, Dr. Prachi.
Thank you.
So, to set the context of our discussion and make the most of time, we have to start and let's begin by looking at how technology is fundamentally reshaping oral healthcare. So, my first question is to you, Dr. Sandesh, that which digital innovation do you believe will most significantly improve precision and patient outcomes in coming year, and also your advice to the young dentists looking to build sustainable and innovative dental practice today?
Uh, it's a very what's an apt question for young dentists as well as for practitioners like us who are practicing for more than 40 years. First of all, one should understand that anatomy, physiology, and pathology of the human being has not changed. I'm in oral pathology. I can vouch for. I mean, I know exactly. Everybody knows that the anatomy, physiology, pathology is the same. Then why this technology has come into dentistry? Any technology which comes into dentistry has to be benefit for the patient. And when it is benefit for the patient, ultimately it becomes benefit for dentist too. So for a young dentist nowadays, what I saw that they start practice with lot of innovative, latest equipment, instrument, material. I feel that first any young dentist should do the basic job before getting into the high technology, which requires lot of learning curve. If you are talking about technology like scanning instead of making an impression, fine, they can have that because scanning, as the other question was, which is the best equipment digital which will be in future, is any equipment which helps the objectivity, that is the fitting of the restoration and giving the guideline and not the final for the aesthetic purpose, because anything aesthetic is subjective. It has to be according to the facials. I mean, there are a lot of factors related to the human face, as no face is the same, no dentition is the same. So you can't have a replica of the same teeth. It then becomes a technology based denture teeth. So understanding the basic anatomy, physiology, and understanding the basic aesthetics of individual tooth, one can do good aesthetics manually, but digital can help them to get into a sort of a near perfection between ratios, etc. Most important aspect for getting into digital technology is ROI, and that stands good for young as well as old dentists, return on investment. Just because your neighbor is having something you should have, or just because Google says or trader says, because digital dentistry or any dentistry which has started in this country is mainly what I say is promoted by dental dealers, traders, manufacturers. Every clinic don't require all this thing. Clinics, what is required is depending on whom you are working, whether the patients are aware of it, whether patients you can they know that they will pay extra cost for the digital stuff, which can be equally good with manual also. A simple example I can give about myself: in 1994, I got the laser, which was costing me 2.5 lakh of rupees. And I was just, before I could buy, I was trying. I went to Israel, the country of the talk today. I got it and I was trying it. If I take an incision with blade, I used to charge patient 50 rupees, my cost price. I mean, my price to the patient, 40 rupees was my profit. If I take a laser incision, it is 250 rupees, but profit is 40 rupees. That means 210 rupees I have to give to equipment guys. Similarly, when the digital technology comes in, you have to first find out your patient's category, whether they can afford to pay. Otherwise, you will be just working and charging your patient for the company rather than for yourself and for the patient. So, friends, the basic thing about high technology, digital, etc., it has got learning curve. You learn, sit down with your accountant, sit down with your patient base and decide that, okay, there is a return on investment. If not in first year, second year, after third year onwards, there will be a return on investment. So that ROI has to be thought on anything you buy in digital dentistry, and which is the future. But as we go further and further, like for example, we bought a scanner for maybe I got a scanner, first scanner for about 15, 18 lakhs of rupees. Today it has come down to 3 lakhs, 4 lakhs, etc. So one can wait and when the things which have become common, you can get that at a less cost, so that it's easy for you to uh, uh, finance them when you are young practitioner between 1 to 5 years or 5 to 10 years. Subsequently, you can get into high end as your income comes in. You can invest straight into your equipment, instrument, and so I think digital is future, but you have to calculate your patient's base, your finances. Even if your father-in-law is very rich, even if your father is very rich, every penny you spend has got interest, has to come back as soon as possible. So if you think ROI, if you think digital, so today the other question was which are the digital equipment which is the future. The future is scanners, 3D printers, which has got objectivity, whether it's direct restoration, that is crown and bridge work or laminates in patient's mouth, or implant restoration, or my other specialty is TMJ orofacial pain. So digital can be used in TMJ orofacial pain. But again, I will buy today also, I will buy everything concerning my patient base first, the demand from the patient which I can generate, and my investment, the finances which I have. Otherwise, what happens today? Lastly, I would like to speak an example of one of my patient went to one high-end, very big clinic in Mumbai only, and I was surprised that young dentists can spend so much money in place as well as equipment instrument for a simple class 2 cavity. Because he had got CBCT, he took CBCT, he took that big 3D X-ray for simple class 2 cavity. That means he want to charge. He said that anything, everybody comes to my clinic, I have to do ABCD. Yes, scanner is useful. You can use scan for everybody, because once you scan, you don't require intraoral camera. You can show them the cavities, etc. So the basic thing what everybody needs today in their practice is a scanner, intraoral scanner, which is the first thing. Then comes the other things. I hope I have answered it. You are on mute. Vaishnavi, you are
Yeah.
on mute now.
Yes, yes. So thank you so much for summarizing that question so insightfully and sharing that ROI is, yes, a very important factor for all the practicing dentists. Before making an investment into any device, they should think from that lens and learn from all the experiences that you have shared on our session today. So, thank you so much for sharing those insights, sir. I'll take the discussion forward and I'll ask my question to you, Dr. Ritu, that how do you see digital technologies such as AI diagnostics, digital orthodontics, and 3D treatment planning transforming dental education and clinical training in India?
Thank you, Vaishnavi, for giving me this opportunity. Uh, I think I would take forward from
Sandesh.
Dr. Sandesh Mayekar, and I must acknowledge this platform. Whether I don't know whether Dr. Sandesh remembers me or not, I was his student in GDC Mumbai. So I would
I
I
remember,
would
I
always.
remember, I remember.
So good evening, sir, and
Good
I
evening.
also would endorse whatever sir has said. Yes, the technology is now in it is coming not only in dentistry, but yes, technology is coming in our lifestyle. Now the child is born and he has a mobile and with various apps in his hand, and yes, information is at your not, we used to say that things are delivered at your doorstep. Now everything is available on your mobile. But as far as Vaishnavi, your question is concerned in terms of orthodontics, I still believe in my own skills and the diagnosis what we make after seeing the patient and with our own experience in the clinical setup. you just can't have a similar kind of diagnosis and treatment planning, even if you are using AI models for diagnosis. Yes, it could be as an adjunct to know that what are the various options available to you, but you are not dependent on the options which are given by AI or any other software in terms of your diagnosis. You may go wrong. We have to learn that it is too premature to just depend on these AI models as far as the diagnosis is concerned. Uh, if you remember, if you send any patient to the diagnostic clinic, every radiologist, when they are reporting, they report that it should be the findings, the radiographic findings should be collaborative with the clinical scenario. Similarly, I would say that all the analysis and the outcomes, what these softwares are giving you in terms of your diagnosis and treatment planning, the clinicians have to be, they have to use their mind in applying those to the patient, because it may not be required for all the patients as such. So the what you say, whenever these are, they should always be taken as adjunct, not as the only tool which will guide you in planning and giving you treatment options. Yes, the world is progressing, and I fully agree with Dr. Makers in saying that as youngsters, you have to be updating yourself in all these technologies. But if your basics are correct, you know your subject, you know how to use this technology. So, to my younger generation dentist, I would say make use of this technology, but just don't become dependent on this technology as far as your patient care is concerned. Till date, how we are using these technologies is, yes, for making our records digital. That is the most important thing. Yes, you can make your clinics and your hospital data as paperless. You can preserve all the data information about your patients in a digital form. For communication, yes, as far as the tele dentistry is concerned, it is very useful. People who are sitting remote, they can take consultations through tele-dentistry, and it is very useful. And I would say that such technologies are better if you are sitting at remote and you are reaching out to specialists for some consultations. Yes, it is a wonderful tool. uh, Record keeping, yes, it has a lot of material for the research. So as a researcher, you have lot many things to find out. There are too many research questions to be placed forward. In our specialty, as most of you know, that now the braces are being replaced by aligners. The advertisement is going to be happy with the kind of advertisements which are being played on media, that orthodontics is so easy that by sitting at home, the crooked teeth can get aligned. And it is, now there are too many Indian players also who have started their own labs and giving those aligners with lesser cost. But I would say that you need an expertise, even in spite of getting everything at doorstep, that expertise is needed. So such kind of treatments should always be at some clinic with monitoring and with a learned people only. I'm not saying that doing aligners is bad, but aligners is something which is taking us away from bending the wires. Our thinking capacity, our dependency on software is increasing. It is like now nobody remembers the telephone numbers of our friends, our dear ones. So a day would be there that we would be going away from our basic knowledge. So as of today, I am for digital, but not totally dependent on digital. Few areas, yes, they are very good. That's all I would like to say today. And yes, AI are very promising, but what you feed is what you get, and the privacy of your data is very, very important. So, what you give, you have to maintain the privacy of the patient's record before you give these records to any a for preparation of any AI model. So, as far as the ethics are concerned, we have to follow all the ethics before we get driven by AI technology. Thank you.
Yeah, thank you so much for summarizing it so well. And I think it was quite elaborate for everybody to understand that how should these technologies be adapted and used. So, taking our discussion forward, next question is to you, Dr. Vikrant, that how can technologies like tele-dentistry and digital screening tools help bridge urban-rural divide and improve early diagnosis of oral disease?
Good evening, everyone. I hope I'm audible.
Yes, yes, you are.
Yeah. So your question was regarding the use of technologies like tele-dentistry and digital screening tools. So let me first give you a perspective in terms of why exactly all these technologies have come into picture. So oral health, as we all know, has been neglected over the years. Number one, and even though over the years the number of dental clinics and dental colleges have been mushrooming, and we still feel that there is need for dentists and but on the flip side we see that the burden of disease has not come down. If there are huge number of dentists, there should have been reduction in dental diseases, but that is not what the picture is. So there is still remains a gap, mainly in terms of access, in terms of utilization of care. And even though we talk about the awareness has increased, but we still don't see people translating that awareness into action. And action in terms of obviously taking into consideration oral health, their oral health needs, because most of the time patients either visit most of the dental hospitals, because I work in a public or a government hospital, so I know the kind of patients that visit us are primarily who come on a very later stage of their dental problems. So that is something which is again difficult to manage, and it is time taking, time consuming, and the number of patient load is huge. So keeping those things in background, number one, though the availability of dentists is there, but still they are all situated primarily in urban zones or in the tier 2 cities, I would say. Two, even though the awareness has increased, utilization of services are not increased. And three, the access to dental quality dental care still remains a big challenge. So keeping these 3 points in mind, and one more point, very important point, is knowing the kind of population or the country, the geographic area that as a country we cover, in terms of the land space, in terms of the population per se, and the density of the population. So we have these problems at hand, and knowing that these problems are there, we have to look for solutions in terms of how we can address them. So here, please allow technology to enter the scene. And technology per se, in various formats, can not only bridge the gap, improve the access, reduce the kind of burden that we're looking at, and look at increase in utilization and timely utilization of dental care, and obviously address the population needs at large. So that is what technology is doing for us. Then coming to what technologies that we're looking at. So we talk about I'll talk about tele-dentistry in some time. Tele-dentistry has been there for quite some time now, but I will come to tele-dentistry a little bit later, talking about digital screening tools. What is important is that many of the times the patients who are having a white patch or a ulcer which is not healing, or are advised, either they're overlooked sometimes or have been missed by certain dentists or other healthcare professionals. One, because there is inadequate training, but at the same time of the clinical load they might miss it. So what we are looking at is reaching out these people in a timely fashion, so that they don't suffer the consequences of these untreated disease which is on high on burden. So using digital screening tools, like there are many digital screening tools, just to name a few. Again, we'll talk about the flip side of these tools because they still remain very expensive and out of reach. Just one example is, well, again, it's just a cancer screening tool which can be light based, and you can use that particular tool to diagnose early cases of pre-cancer and refer these patients timely. Training of these training of and use of these digital tools can be done with the help of frontline health workers, or people working, like for example the community health officers working in Ayushman Arogya Mandirs, or ASHA workers. They can be trained in diagnosing using these digital tools and capturing them and sending the data back to the center, where a dentist can review it and further recall the patient in terms in case further care is required. When it comes to teledentistry, teledentistry has been very, I would say telemedicine has been very much popular and has been there for many years. And teledentistry also has been there for many years, mainly in the Western world. But with the advent of COVID, brought in the reality was out there, and we could not move out because of certain restrictions. And there, the importance of teledentistry, telemedicine was enhanced. And the government of India was very quick to take up the stand, and they launched their e-Sanjeevani portal, which is a very popular portal for telemedicine, and teledentistry also remains a part. So what I would like to say here is that we have evidence from the COVID lessons learned from there, where we can bridge the gap of the access, utilization, increase of awareness, and reduction of the population burden of oral diseases by use of teledentistry. Teledentistry, I do understand that it will not be able to fulfill all the needs of a patient, but at least certain basic needs, where patients can reach out to specialists sitting, and even their radiographs can be sent to experts sitting in a central hub like area. And experiences from, I have an experience of Odisha, where the SCB Dental College in Cuttack has been instrumental in implementing teledentistry across Odisha. So they work with the primary health care centers, and they refer there's a specialist timing given for doctors to sit in a hub where all these cases are sent. They are reviewed and they are discussed online with the patients in the rural areas. So there are such avenues, experiences there. What we need to do is we need to standardize them further. We need to regulate them better. At the same time, develop a protocols, proper standard operating protocols have to be in place, and proper training and hand holding has to be done, so that such technologies are not only used by our own dental colleagues, but also with the help of our health workers who are the frontline workers. So I think digital technology, mainly as what you just specifically are talking about in terms of teledentistry and digital screening tools, can help a long way in transforming as well as reducing the burden and bringing the geographic divide which is there, which is across our country, where you have general practitioners at one end and specialists at very on the up the scale or up in certain areas. They can bridge that gap and bring such kind of collaborative work, so that ultimately the patients are benefited. So that's my take on what teledentistry and digital screening tools can do. Thank you.
Correct. Yeah, thank you so much. So, my next question is to you, Dr. Amit, that with the rise of guided surgery, 3D printing, and digital planning, how are these innovation transforming complex procedures in oral and maxillofacial surgery? Dr. Amit, please unmute it.
Yeah. Maybe. So, as this guided surgery, 3D printing, and digital planning now in maxillofacial surgery are a day routine practice, and to use them, they enhances basically the predictability, the we can do the surgery with more precision with the help of these tools, and also the safety of the patient improves by using all these guided surgery and 3D printings. The preoperative virtual planning can be done. It can also be explained to the patient what outcomes we expect from the surgery, and patient, especially in the case of patient specific implants, that is called as PSI, are very helpful in because of these tools. And guided execution, it also reduces the surgical time, it also reduces the complication. We need to know about all the various anatomical details, and also it improves the outcome of the complex cases. Earlier we used to tell about the complications and we just close it up, or we do it in a compromised manner. But with the with the help of all these tools, with the guided surgeries and the 3D printing and all that, the outcome has improved a lot. And as all senior people have told, still still the clinical outreach or the clinical experience plays a very important role in all of the maxillofacial surgery cases. What to do and what not to do still is in the hand of the surgeon only. So that has to come at last and in the beginning for all the surgeries. Although they are helping us a lot, but still the clinical outreach, the clinical experience plays a very important role in all the surgical cases. Thank
Then,
you.
yeah. So my next question is to you, Dr. Purohit, that how can digital platforms support large-scale oral health screening and preventive programs in India?
Yeah, that's a wonderful question. I think the half of the question is already been answered by Dr. Vikram sir, and basically he has covered almost most of the part of it in the screening part. Uh, I can say that the screening, and sir will agree with me that screening tool as such like AI tools are acting as a reactive models. They are treating the pain and limiting or preventing the dental disease. So many such AI tools are already there in the market from past 2 to 3 years, and we have noticed that few of the models have been developed even by the government and government dental colleges. It has been noted that the screening which has been carried out by the humans or by the dental professionals, again they are overburdened because of the density of the population, which has already been beautifully explained by Dr. Vikrant sir. And because of the population, we are not handful to deliver the dental problems, dental issues, or screen the population at large. So there are many AI tools which has been developed, which can just a click of a phone, and for the oral pre-malignant disease or conditions, or to identify the early signs of dental diseases, those tools have been developed. These tools basically they analyze it, and then the information can be shared with the professionals, where they can automate the triage, in which can identify the high risk population, and high risk population, and delivering the treatment to those high risk population who requires the treatment the most. Tele-dentistry already has been beautifully explained by sir, and then integrating the data which we have through the AI software, and from the Aishman Bharat digital model which has been developed by the government, is a beautiful model in which the data can be fed and can be shared with many others, where the data can be used for research as well as to cater the large underprivileged population. Coming to the preventive part of it, we have seen that the prevention can be done through AI assisted technologies. Like basically, when you are able to identify the problem at the early stage, it helps us to educate the masses at large, and also through the gamification among the young children who are going to have cumulative dental problems, or an early intervention can also help in educating them, and can help them to identify what dental problems they are, and can be prevented at very early stage. Thank you. That's all from my side.
Yeah, thank you so much. So, my next question is to you, Dr. Prachi, that I mean, how can these platforms, which is digital platforms, teledentistry, and portable technologies, enable scalable and patient-friendly dental care services outside the traditional clinics?
Hi, everybody. Good evening. So, great question. Thank you for asking something that is very much relevant to what we are also doing today. Now, see, the main thing is that if we look at dentistry today, the biggest gap is not a capability gap, it is an access gap. We have skilled dentists, so many skilled dentists. We have so much strong clinical knowledge. In fact, every year, about 30,000 dentists graduate from dental colleges all across India. We have good material, the best materials, imaging, increasingly sophisticated tools. Moreover, more than the dental colleges, also there are so many refresher programs available, continuing education platforms. So definitely there is this intent to learn and upgrade. But what happens is, despite of all of this, a very large section of patients does not receive timely dental care. This is because we are running dentistry based on one assumption, that the patient will come to the clinic. This assumption kind of excludes a large number of people. For example, bedridden people, elderly people, people with dementia, Parkinson's, stroke, complex medical conditions, chronic medical conditions, special needs patients. It can be as simple as an elderly 85-year-old person staying on the third floor of a building without a lift. So this simple act of walking up and down the stairs every time the patient has to go to a clinic can act as a deterrent to get good dental care. So another layer is that many dentists, so all of the dentists that come out of dental colleges today, they are trained in a very controlled clinical environment. They are treating relatively stable patients who are capable of coming into a clinic. So when you step outside this environment, the nature of dentistry changes significantly. Like, for example, we recently had a patient who undergoes home dialysis once in every twice a week. We did her extraction, and of course with all the consent and everything taken from the physician. Extraction, and it was root piece, simple 2 3 root pieces had to be extracted. The extraction happened very uneventfully, with minimal discomfort. Post extraction also, the patient, she did not have to take any additional medications or strong painkillers. Everything was fine. Cut to 3 to 4 days after we finished our procedure, suddenly the patient calls us saying that there is so much bleeding from the extraction site, and we were also confused as to how can this happen suddenly after 4 5 days. So in that meantime, what had happened was, 3 to 4 days after the extraction was done, dialysis was done on her. And the technician who comes for dialysis, the physician forgot to mention that, as we all know, heparin is added during dialysis, so as to prevent formation of blood clots. So this heparin that was added led to delayed bleeding and everything. So this is something that is missed out mainly in our routine clinical practice. Another example is that patients with Alzheimer's, dementia, the kind of patients that we normally come across, they are not going to be able to follow our instructions, to follow our post-op instructions. Something as simple as do not spit for the next 24 hours post an extraction. They are not going to be able to do that. So we have to ensure that the care that we give them is taking into considerations the patient's own limitations as well. Like, for example, what we do is give sutures for these patients anyway from the start, so that issues like dry socket and all these things do not happen in them. So these are not edge cases, these are real everyday scenarios when you step into this segment. So of course, addition of digital platforms, teledentistry, portable technologies then become very super important. Now with digital platforms, we have intraoral scanning apps. So many digital screening apps have come on these days. So patients can share images, they can do self screening also. Symptoms, medical histories, and everything can be done remotely. And this will help us to assess the urgency. It helps us to plan interventions properly, to decide the feasibility of home care properly, and prepare us much better. Then the second layer is teledentistry. So, of course, teledentistry is not the final solution, because unlike other medical fields, dentistry is quite procedural. You cannot solve everything over a phone call, but it is a great enabler. It reduces friction. And so, also, basically, whether you and also when you combine this digital coordination with portable infrastructure, you are not just advising patients remotely, you are actually delivering treatment where the patient is. So at Dent at Home, that is the shift that we have focused on. We are not doing just consultations or small treatments. We are delivering clinic grade procedures, including extractions, dentures, complex treatment outside of a traditional clinic. To do that, we have to combine, of course, portable dental units, but also these imaging systems, trained assistants, trained specialists, strict workflows, strict sterilization protocols. So uh, basically, this ensures that just because it's happening outside a clinic, it is not inferior. Because the reality is that the standard of care is defined by these protocols, case selection, and the execution. So basically, so that is my point during all this. So digital dentistry can help standardize all of these things. Portable technology decentralizes how care is given. Protocols will ensure consistency. So when all of these things come together, so that is when the real change happens. And so basically, this is the real future, which is distributed dentistry, taking into consideration all the aspects that have evolved over the period of time. So yeah, that is it from my side.
Correct. So I think we have covered the innovation part and I think we should talk about affordability and integration into insurance. So since we have Dr. Sandesh with us, I would like to hear from you, sir, that despite the importance of oral health, dental treatments are still under not under the mainstream, and they are not part of the health insurance in India. So what changes do you believe are necessary to improve dental insurance adoption?
Now, let me tell you about insurance per se. Insurance work if the insurance company gets something out of the premium. Like if you take car insurance, 100 car insurance, 10 car goes for accident, 90 premium they get, and they can run the insurance company. In dental insurance, every human being has a problem. Till such time they modify in such a way that they give you insurance in conjunction with dentist. For example, if a dentist is charging 5,000 rupees for scaling, two scalings is 10,000. Say the insurance company says that I'll come to you, you can charge them less amount of money, and they take the premium for basic thing. It has to be modified. If you go and compare the insurance company in United States and others, government is involved in that. Here, government is not going to give subsidy for insurance. ADA, everything is subsidized by government. So insurance working in India is difficult because we tried insurance for 30 years back, you know, but it's very difficult, but it's not impossible. So corporate people for routine checkup and for basic, if the insurance is taken, I think when there is a cavity, etc., you can get away with that particular aspect later on. So for me, insurance is has to be worked out specifically for corporate and then get into the regular thing. But my question is, there is a Aisha. I mean, I got AIMS government person. I got government person working with, he's listening to us here. We should go to Ayushman and tell them that the 5 lakhs of rupees are given to poor people for operation. They have to give us only 500 rupees annually or 6 monthly to do a checkup and scaling. They can easily give them for poor people. The problem is in dentistry, no one dies. So there is no insurance for everybody that, okay, I'm going to die, so I have to have insurance, etc. People feel, poor people feel, अरे एक दो दांत गए तो क्या हो गया? I got other 30 teeth with me, but they don't understand one tooth missing can cause problem. So the education and prevention for these people, category wise, low economical, because for them the priorities are different. So basically, all the speakers who are here, they are all well known. We have to start marketing dentistry to poor people that oral health is good, your general health is good. And that has to be emphasized on government also to give importance to oral health. Nobody gives importance to oral health. If you see, they only say about Ayurveda, Unani, homeopathy, and medicine that they should be together, allopathy to be together, not to be together, etc. But where is dentistry involved in even in discussion in parliament? They don't even think about it. So we have to start from our end to educate public at large just for checkups, which we are doing it, but just for checkup, and have some insurance for those people from government for poor people and corporate for them for checkup so that they can maintain, because if the small cavity is catch at the checkup level, the expenses are less. So I feel insurance has to be modified according to the category level of people, from poor people to the richest people, and education to every human being, especially low category, that saving, just if you maintain your oral health, teeth will go with you. And I feel that should be the only thing, that prevention, prevention, and prevention, and early detection. I was just listening to AI and I was just taking to tele-dentistry. I feel AI and tele-dentistry will not affect dentists per se, because teledentistry is just diagnosing and giving them some medicine. Your fingers has to go in patient's mouth. AI can't go in patient's mouth. We are doing clinical study on robotic for laminate preparation in India, in Pune, Savita, as well as in my clinic. And we have found that robotic also is very difficult. It is a future, but it's a minimum invasive that will come. So, friends, let's educate people at this stage. AI, digital dentistry, all these things comes to people who can afford. Insurance is not going to pay you for digital, etc. Insurance will pay you for the basics. And let's go to basic. The young dentists, 30,000 dentists who are coming out, let's go to basic. And just appreciating the home visit, I think they should start home visit with young dentists just for scaling, because nobody goes to scaling and simple checkup to dental clinic because they have to take appointment, etc. But home visit, Dr. Deval can start that just for checkup and simple cleaning. I think that will educate people at large that prevention is better than cure, because in dentistry, there is no nature cure. Once it is disease, tartar formation or whatever, it is gone forever. And lastly, about white patch, etc., I'm an oral pathologist. Instead of talking about cancer, cancer, and cancer institute, etc., let's talk about pre-cancer, which is curable. And if you talk only about pre-cancer, catch the patient at pre-cancer, catch the patient at pre-cancer condition, patient patient will not be afraid to go to a dentist for checkup of the white patch, rather than they will say, "अरे cancer होगा तो देखेगा तभी क्या होगा तो." So let's work on prevention, which will be a great thing. So today being a World Oral Day, I think we should speak. We should concentrate more on prevention. Digital AI is for high-end dentistry in city and two-tier high-end dentistry, but combination is good enough. Anybody wants to get into high-end, they can go to digital, and masses has to be considered in this country. Thank you.
Thank you. Thank you so much. So my next question is to you, Dr. Ritu, that how can preventive oral healthcare be integrated into broader healthcare systems and insurance framework? Dr. Ritu, are you there? Maybe there is some network issue at her end since she was traveling. I'll take my next question to you, Dr. Vikrant, that how can policymakers integrate oral health care within the national programs like Ayushman Bharat and universal health coverage?
Yeah, thank you so much. I think there's some work already in terms of, see, in terms of what Dr. Ritu had already started, that, and what Dr. Sandesh already continued by adding in terms of what insurance can do and cannot do. already the government has come up with this, the PMJ, which is the Prime Minister Jan Arogya Yojana, and under that you have the Ayushman, Arogya Mandirs, which have come up now. And these Ayushman Arogya Mandirs are basically the first point of contact. And there, when we talk about, we have community health worker, health officers, CHOs there. So there, already there are now modules which have been made by the ministry, and trainings across the panel has already been started across states, where CHOs have been trained about management of early diagnosis, and at the same time basic management and quick referral to the next level of care, which is the primary health center, and then further to the community health centers, and then further, in case required, to the district hospitals. So this is already happening under the National Oral Health Program, as well as the Ayushman Bharat uh, program, which we just talked about. So currently, this is what is happening, and ASHAs, CHOs, all of them are being trained in trying to provide this care at the primary level. And in terms of how we are aligning ourselves to global reforms, for example, WHO looks at global reforms, and WHO has recommended at various under six various pillars in which oral health needs to be worked out. And in one of the important components is to have a national oral health policy. Though the country looks at a policy, policy documents are mainly guiding principles, and there is a national health policy, but we will be soon having a national oral health framework, which will be applicable. As you all know that health is a state subject, and health is decided, the health provisions and are decided by the state themselves, depending on their needs and their structure which is available. And the central government provides not only guiding principles, but also supports them in implementing it, overseeing it, and looking at what are the success stories and what are the gaps. So a national oral health framework would be more ideal in terms of, and that is what, being a member of the national steering group myself, with the under the NOHP, as well as working with pioneers like Ritu ma'am and others at the ministry, we know that such a policy document and discussions are already happening, and the government is very, very keen in addressing these gaps. Over the years, I think now under the National Oral Health Program, more than 9,500 dental clinics have been established, which in itself is a great achievement in terms of the last 10 years. Other than that, the National Oral Health Program has supported and strengthened the district hospitals, as well as recruited a lot of human resources across the program. And when I'm talking about all these figures and facts, I'm trying to tell you is that the government is thinking. That is why all this is happening. So the government is planning, allocating funds, making the funds available. Yes, there's always a demand for more of anything, but it is not that we have seen oral health transform in the at a national level in the last 10 years. We have seen how oral health, and now we have national resource centers come up, and these resource, and the pioneer being with Ritu ma'am's, they are a NOHP, a Center for Excellence, and they are guiding the whole country in terms of how oral health has to be implemented. And I am a part of one of the national resource centers for oral health and tobacco cessation. So we are training 300 plus dental colleges, working with state governments to implement tobacco cessation in a standardized way across the country. So all this is only possible. And similarly, we have one at PGI Chandigarh, where they're looking at geriatric as well as pediatric dentistry, and one at Lady Harding Medical College, where they're looking at oral pre-cancers. So and many more such regional centers at the national as well as regional levels are in the pipeline. And all this is only possible because the government, the policy makers are thinking. There are now experts, with due permission, with ma'am and many of experts across the country who are a part of such implementation strategies at the center. And because the government is thinking, allocating funds under the National Health Mission, such transformations are happening. So it is important for all of us to actually go back, as we're talking about reimagining oral health care. All of us come with different perspectives. It is important to go back to the grassroots and check what is happening and what is not. And I know that the gaps are still very large, but it is important to also see what is happening and then come back and try to work towards how we can bridge those gaps. So there is a lot of scope still, but there is a lot that has been done. And I think the government is very clear in its approach. With such robust infrastructure and health system strengthening happening, we would obviously see in the times to come that the burden of disease as well as access is improves, and the burden of disease, oral diseases, reduces. So thank you so much.
Yeah, thank you so much, Dr. Vikrant. Yes, I would like to hear from Dr. Ritu since your question was skipped in between. Anything that you would like to add to what Dr. Vikrant just mentioned, since a lot of it is being done under your supervision? Because the question is somewhere around that only, that how should oral healthcare be integrated into the healthcare system and the insurance framework? Over to you, Ritu. You're on mute. You'll
Hello.
have to. Yeah.
Sorry, I lost connection in between. So, taking forward what Dr. Vikrant said, I think he has beautifully summarized what the government is thinking about and what are the initiatives government has already taken. Uh, Now, I lost connection in between, but I just want to talk about something about insurance. Dr. Sandesh was saying that the insurance policy should have been there for each and every citizen of India. It may not be possible because we have different diversity of care system in India. We have some tertiary care hospitals, we have some district hospitals, we have some primary health services, and the kind of work each center is giving are not comparable to each other. As Vikrant has already mentioned about the various programs which Government of India has already initiated, Ayushman Bharat, which has a ceiling of 5 lakh rupees, only patients who are seeking some surgical interventions and that require an indoor facility in the hospital. Why this is happening, we cannot fix up the rate even if 500 rupees are being asked by any insurance company, because we don't have consistency of the rates charged by the dentist in the private sector. Unless and until you fix up the charges as per like different categories, A class, B class, or C class dental clinics, and those rates are fixed and standardized, and all of us are ready to abide with those prices. I think government can think of uh, putting some ceiling on different procedures. But whenever this has been debated, it always comes, there is so much of variability in the charges. At times, any corporate or any hospital, if they are also having any insurance, they would like to match with the CGHS or AIIMS uh, rate list. So, how can you compare a practitioner who is sitting in a very posh colony, charge the same treatment charges which are being uh, charged in a hospital, or it is nearly done free for the patient? So, till that disparity exists, I don't think so. Each one of us will get benefited by the insurance policy under the for the dental treatment. Yes, the government is taking a lot of initiatives. As Dr. Mohanty has already said, that it is a state matter. And now the state and the center has to have a similar kind of thinking, and all these states across should come together and find some solution. Yes, maybe with new dental commission, we are looking forward that few gaps will be covered soon. Thank you.
Yeah, thank you so much, ma'am. I think we're also running short of time. So I'll take my question to you, Dr. Amit, and I would quickly ask you that how can financing mechanism or insurance model help make complex dental treatment more affordable? Yeah.
Yeah, I'm on moon now. So Basically EMI based financing, or we can say a procedure specific insurances, and we can have a bundled package for the treatment that can reduce the upfront cost of the treatment, and it would also be improving uh, the patient acceptance. The EMI based financing, that is equated monthly installments, the patient can pay treatment cost in small installments. Then it removes the immediate financial burden to the patient. It makes costly procedures like implants, orthodontic surgeries more acceptable, and it increases the treatment acceptance rate also. So, like for procedure specific insurances, the insurances plan can be planned for the specific dental procedures, if specifically for the trauma surgery, for the implants, for tumor resections, for all these. And unlike general health insurance, the target's high cost dental treatments can be achieved by having a specific procedure, sorry, specific insurances. Now it helps by it covers partial or full cost of the complex procedures for the maxillofacial surgeries or for the dental treatments. It also encourages patient to opt for timely treatment for rather than delayed treatments, and it reduces the patient expenditure also. Then the we can have bundled treatment packages that will improve the cost transparency, that will also build the patient trust, and easier financial planning can be done for the patients. So combined impact of all these things will be the EMI for the upfront cost will be reduced, the financial risk is reduced, and the cost clarity is increased for the packages. That results basically in patients' acceptance rate is increased, better treatment compliance, and it also improved access to the advanced maxillofacial surgery cases, or the surgery planning can be done and can be supported with all this financial support. That's all from my side.
Done. So, since we are running short of time, we'll quickly jump to the rapid fire section. So, I'll take those questions to you, Dr. Purohit. That one dental technology, or what is your one advice or one myth about dental insurance that you would like to address through our forum today?
Dental technology as such, like pointing out one dental technology, I can talk about my profession and my specialty, where the public health screening part of it. To make our job easier, we need to have the screening devices which can be utilized, so that the data can be collected at very rapidly. Why? Because at one given point of time, we are addressing sometimes more than 1,000 people in a day, and we get limited time to screen those population, and most of the disease can under means they can go unnoticed. So in that case, I feel that the screening instrument, through intraoral cameras, let's say, or through the scanning device which are already present in the market, can be utilized. Coming on to the insurance part, I think from the in the very beginning, Dr. Sandesh Mayekar sir has already said that it is a very important tool, but then it needs to mature and it needs to develop still in the country like India, where the premiums may sometime will be very low than the treatment which is given to the patient. So, and also the cumulative disease load in the patient, and such patient will only enroll into as such plan where they will be given a particular uh, there where they can be insured for their particular problems. Thank you.
Thank you so much. So my next question is to you, Dr. Prachi, that what opportunity do you see for startups and technology-driven models? Just a quick answer from you.
So here, I mean, basically, the problem is right now, dentistry as a field is quite unregulated. It is quite fragmented. It is clinic centric. So instead of, asking how can we do dentistry better, The main thing is we should have a question that should be answered is, why is the system designed in such a way in the first place? One of the biggest opportunity is that, the clinic can be one node of thing of where treatment can happen, but it can happen at a home also, it can happen in an elder care facility also, in a rehabilitation center also, in a community setup also. Along with that, there is the need for standardization, because in India, dentistry is still personality driven. It's dependent on the dentist as to how his or her practice can flourish. Now, there have been some basically startups here have the opportunity here to build better systems, better protocols, better patient journeys, better digital records with consistent follow ups, so that quality of care becomes reliable and it is not variable. And we are seeing some level of corporatization in the field, where scale is achieved through multiple centers, through larger networks. But as we can see, that is often at the cost of outcomes. That is often at Then it all becomes about revenues, margins, and everything. It does not become very patient friendly. So the real opportunity for startups here is not to just scale, but to scale responsibly, so that this standardization can improve outcome rather than reducing care to a transactional process. Another opportunity is to focus on segments that have been historically underserved. One of them, of course, being, as I mentioned earlier, the people who cannot access dental care, who cannot go to a dental clinic. Another aspect is in remote rural areas. See, all of our dentists, most of our dentists are concentrated in urban areas, in urban cities. The ratio of one dentist to population is 1:2,000 in a city, whereas it is 1:10,000 in rural areas. So this, if somebody solves for this segment particularly, I think there is a lot of scope here. So basically, wherever there is a large, repeatable, unmet need, there is a strong opportunity to build very meaningful solutions. So innovation here is not just about devices, AI. Of course, they are they are very much important, but how effectively can you match the right clinician to the right patient with the right resources at the right time? So once we start thinking at this level, I think we can kind of build systems better. So basically, uh, the systems, the startups that solve for access, for standardization, for affordability, while keeping the patient's outcomes at the center, these are the opportunities that startups have the most and can milk the most out of it, in my opinion. Because finally, healthcare is uh, scaling healthcare is not just about revenues; it's about patient outcomes and progress. So yes, that is what people should focus on when building a startup in this dental space, especially.
Done. So, thank you so much. It was a very insightful session, especially on the occasion of World Oral Health Day. And thank you to each one of you for contributing to this industry and bringing such thoughts on the table. And thank you for taking out your time for today's session. So, it was pleasure speaking with each one of you. And I hope the listeners would benefit from this and this session. So, thank you so much for that.
Thank you, and best wishes. All the best. Bye bye.
Bye. Good night.
Thank you.
Yeah.